Hello everyone, hello, welcome back to Midwife Par Excellence. It has been about 2 weeks since I haven't seen you. Yes, I had reason to be absent for a while and I must apologize. But today I will be making it up to you. I'll be having a 3-in-1 lesson today, and this is based on popular demand. Alright, so today I will be talking about human papilloma virus. I will be talking about cervical cancer, and I will be talking about the papsmear test, also known as the pap test. Alright, please do not forget to like, comment, subscribe, share, and stick and stay with me here at Midwife Par Excellence. Alright, so let's get right into it. Now, what is human papilloma virus? It says here that it's a common sexually transmitted infection through skin to skin contact. So it is majorly transmitted through skin to skin contact during sexual intercourse. Alright? Once you are sexually active, it is highly possible, as I had said before, that you can contract this virus. And I have them in bulletin. I will just expound on them as I go along. Alright, so it says it's asymptomatic, especially for the males. So while the woman will manifest, alright, while the woman will have symptoms and manifest certain characteristics of the virus, the males remain asymptomatic, and that is the problem because they can have it for years on end, having different sexual partners, and nobody ever knows that they do have the virus because they do not show symptoms. All right. This virus causes warts, and some strains are associated with cervical cancer. Now, what are warts? Warts are some raised lesions on the skin. They can be large or small. They can be broad. They can be flat, or they can be looking like a small clumps of cauliflower. If you know what cauliflower looks like, these are what the warts, majority of the warts are looking like cauliflower. All right. Now, there are over 100 strains of the human papilloma virus. Can you imagine? There are over 100 strains of the human papilloma virus. Now, there is no known cure. All right? So, be warned. There is no known cure for this virus. All right? It can infect the throat, the vulva, the vagina, which can also lead to neck and head cancers. Now, listen, this thing, be warned, ladies and gentlemen, this thing is nothing to be played with. All right? It is something that it's a virus that we don't hear about or talk about every day, but this is no joke, guys. This is no joke. All right? There are two strains. So, of the 100, over 100 known strains of human papilloma virus that exist, there are two strains that are majorly responsible for cervical cancer. All right, listen for the strains. Now, these strains are strains number 16 and 18, right? And these are responsible for up to 70% of cervical cancer cases. You see how serious this is? Yes. The remaining 30% are 12 others. So let us do the maths. There are over 100 strains of human papilloma virus. Now, strains 16 and 18 are responsible for 70% of the cervical cancer cases. Now, the remaining 30%, 12 of those other strains are responsible for that 30%. All right, so you see how serious this virus is. Okay, after being infected, the virus can be inactive for weeks, months, and even years after an infection. Now listen, you realize I'm emphasizing that this virus is nothing to be played with. Imagine getting infected with a virus and you can be infected for weeks, months, and even years before you even know. And most times with the human papilloma virus, it's when you have a wart, and as I said before, the woman will show symptoms more so than the men. All right, and you will be having the infection and you don't know, and it's not until you start manifesting through warts that you really know that, listen, something is wrong, when you would have already had it for weeks, months, or years. All right, and you were asymptomatic. This is serious, guys. This is very serious. All right, now we move on. HPV infects the skin and starts to grow where warts become visible. Now, as I said before, that is when many persons know they even have the virus until the warts start growing. This is serious. HPV strains 6 and 11 are responsible for genital warts. So there are two strains out of the over 100 strains of warts that are responsible for genital warts, and this is strains 6 and 11. So 16 and 18 are responsible for 70% of the cervical cancer stages. 12 out of the over 100 are responsible for the remaining 30% of cervical cancer cases, and strains 6 and 11 are responsible for the manifestation of genital warts. Now, diagnosis. Now, HPV, as we said, it, you might remain asymptomatic for a while, weeks, months, and years. You realize how I'm emphasizing on this. Weeks, months, or years. Now, persons will manifest through warts. So when you're being assessed by your doctor based on the type of warts that you have, your doctor can automatically already know that, yes, this is human papilloma virus. All right. We also do a pap smear test. Now, our pap smear or our pap test is, we take a sample of the cervix, and I will go further about how a pap smear test is done, what it is, and the results. All right, so a pap smear test is done where a sample is taken of the cervix and it is sent to the lab. Now, if there are any abnormal changes noted at the cervix, your doctor can go on to doing a colposcopy, right, which is a more microscopic look at the cervix. And if they're still not satisfied, they will take a piece of the cervix, also known as a biopsy, and send it to the lab to be tested. All right. Now, prevention. Listen, I'm going to read these preventions, and I'm sure we have heard of them every day, but it doesn't hurt to remind you. All right. The first one says use a condom every time. It speaks for itself. Use a condom every time. All right. It is the only thing that will be able to assist you in preventing sexually transmitted infections as best as possible. Use a condom every time, guys. Use a condom. All right. There's a vaccine. So they're encouraging ages 9 to 26 to get these vaccines. All right. So there's a human papilloma virus vaccine. All right. And they encourage persons to get it before they become sexually active. All right. Routine pap smear. Get your routine pap smears done. Every health center does pap smears. All the doctors' offices does pap smears, and there's also pap smear centers everywhere around. All right, get your pap smear done, ladies, please. There's also a vaccine in the making, I'm being told, that even if you're infected, right, it will not become cancerous. So we all know that 16 and 18 are responsible for 70% of the cancer cases. Now, if you are already infected with the virus, this vaccine will help you to not progress to that 70% of persons who are having the cervical cancer. All right? Do your checkup regularly. So I encourage you, observe your body, ladies and gentlemen. You will know when something is not right. All right? And you get to act on it. You get assessed by your doctor. If treatment is to be done, it gets done promptly to prevent further progression. All right? And in this case for the ladies, genital warts or cancer, cervical cancer. All right? Now, removal of warts. The warts can be removed. There's no rule in the book that says once you have the warts, they have to remain there. They can be removed. They come in forms of creams, and there can be done also laser surgeries. All right? Now we're going to move on to cervical cancer. And cervical cancer, it is very common. All right? But there are some things that can be done to lessen the chance of progression. You have to understand that cervical cancer does not progress very quickly. It takes a while to develop. All right? So if you're doing your pap smears, if you're doing your assessments, you're doing your observations, it's highly unlikely that it will progress to cervical cancer without you knowing if they are being monitored. All right? The lower part of the uterus, that is the upper part of the vagina, the lower part of the uterus, that is the area we call the cervix. All right? That is the area that dilates and opens up for a baby to come through. All right? And we're talking about the cancer of the cervix at this point. This is a disease where the cervical cells grow out of proportion. All right? So they go bad. They grow out of control, and hence it becomes a problem eventually, and that's what we call cervical cancer. Now, who are at risk for cervical cancer? Persons who have the human papilloma virus, as I had said before. 2 of our strains are responsible for 70% of the cervical cancer cases. Having many sexual partners. Now listen, for those persons who are having many sexual partners, you are at risk for developing cervical cancer. All right? For those persons, ladies who are smoking, yes, you are at possible risk of developing cervical cancer. Now, for those persons who are on oral contraceptives for a prolonged period of time, these persons are also at risk for developing cervical cancer. Engaging in early sexual activities. So the younger you become sexually active, it's the higher your risk of having cervical cancer. All right, so you want to wait until you're at an older age to initiate sexual activities. All right. For those persons who are immunocompromised, so our HIV clients, these persons, their immune system would have already been suppressed, so it makes them susceptible to other infections and also developing cervical cancer. All right. Having 5 or more children increases your risk of having cervical cancer. All right, so some other conditions can mimic all of these risk factors that I was talking about. So if you're having any of these risk factors and you should see signs, it does not mean that you're having cervical cancer. It could very well mean that you're having another issue. But we're just letting you know that what are some of the risk factors of cervical cancer. So other conditions can mimic these risk factors. So hence you want to get assessed if you're presenting with any of these risks. All right? Symptoms. What are the symptoms of cervical cancer? Now, bleeding after sexual intercourse. So I mean, after you're having sex, after you're through, you realize that you're having some amount of bleeding. It has never happened before, and then you start having bleeding, spotting after you've had sex. You want to be assessed. All right, you could very well be developing cervical cancer. Bleeding after menopause. So you have already established you have gone through menopause, and then all of a sudden you start having abnormal bleedings. All right, you want to be assessed. you could be developing cervical cancer. Remember, we said some persons are asymptomatic, so you might never have any signs. All right, and that is where your pap smear comes in. So when you do your pap smears, even if you have no signs or symptoms of the cervical cancer, that pap smear result will come back abnormal, which will prompt your midwife or your doctors to do further assessment. All right, and most times that's when it is diagnosed or realized. All right, increased vaginal discharge. So on a normal day, you have a certain amount of vaginal discharge, and then all of a sudden you realize that you're having double the amount, excessive vaginal discharges. You want to be assessed. You could very well be showing signs of cervical cancer. All right. Bleeding or spotting between periods. Bear in mind, as I said before, there are other symptoms of other conditions that could be causing this, but if you're seeing any of these symptoms, you want to bring it to the fore and be assessed to rule out cervical cancer. All right? Pelvic pain. So you're constantly having pain in your pelvis. You want to be assessed. All right? Pain during sexual intercourse. So sexual intercourse is no longer fun for you. It's more pain than anything else. You want to be assessed. All right? As I said before, these symptoms can present with other conditions. So assessment is of paramount in this case. All right? Diagnosis of cervical cancer. Now listen. Pap smear test. Get your pap smear test done, ladies. Please. Gentlemen, please encourage your ladies to get your pap smear test done. It is very important. All right? Now, pap smear test is done to rule out cervical cancer. It can also detect certain vaginal infections such as your trichomoniasis vaginalis or your bacterial vaginosis. All right? If the result is returned abnormal, they will do a biopsy of the cervix. Doctor might also order a colposcopy, which is a very microscopic look at the cervix. And pending the result of that, then they will do the latter, which is the biopsy, to take a sample of the cervix to be sent to the lab for testing to see what it is. All right? Now, stages of the cancer. So when you hear a person say stage 1, stage 2, stage 3, stage 4, now I'm going to highlight what these mean. All right, so in the stage 1, the tumor has taken over the cervix. So the cervix has been taken over by the tumor. All right, however, it has not spread to anywhere else. So in a stage 1 cervical cancer, it remains right there at the cervix. All right, yes, it has not been spread to anywhere, any neighboring organs, anywhere at all. It just remains at the cervix, and that is for stage 1 cancer. Now, stage 2 cervical cancer, it extends to the upper part of the vagina. All right, so it's getting real serious now, and that's stage 2 cervical cancer. For stage 3, it has spread to the lower part of the vagina. It may also has possibly invaded the pelvic wall, and it can also start affecting the kidneys. Now listen, this is getting real serious. All right? So it's now spreading to other organs and possibly the kidney, and that is stage 3 cervical cancer. Now, in a stage 4, it invades the bladder, the rectum, and it is spreading to other organs. All right, so you see how important this is, and as I've said before, cervical cancer does not pop up on anybody. Cervical cancer takes a while to develop, so it has been there, and because you have not been observing the changes of the previous symptoms that I spoke of before, or you have not been doing your pap smear test, you would not have been able to observe abnormalities. And as I said, the pap test returns abnormal, further tests are being done. All right? Now, what can I do to prevent cancer, cervical cancer, or try to prevent? All right, so you get your pap smear done, and I cannot emphasize this anymore. You get your pap smears done. All right, it doesn't hurt. It is a little bit uncomfortable, but it should not be painful. It's a process that takes about 5 minutes. That's it. All right, ladies, please get your pap smears done. I am begging you. All right. Now, follow up your pap smear results. So, not only are you going to do your pap smears, you want to follow up on your results. Bear in mind that for your healthcare provider, if when your pap smear results return and they are abnormal, we will definitely call you. Right? Rest assured, you will get a call from your healthcare provider if there anything abnormal about your pap smear results. Try as best as possible to have only one sexual partner. All right? It is very important. We have to take responsibility for our actions at this point, and trying to have one sexual partner, it is very safe. All right? Now, use a condom. As I had emphasized before, use a condom every time. For those persons who are between the ages of 9 and 26, get the HPV vaccine. All right? Get the HPV vaccine. All right? Now, treatment. As I said before, surgery, radiotherapy, chemotherapy, among others. All right? Now, we're going to be moving to a pap smear. What is a pap smear test? And this is a test that is done to rule out cancer of the cervix. That's basically why we do a pap smear. I had put two additionals there. The pap smear can also show if there's any vaginal infections like a trichomoniasis vaginalis or a bacterial vaginosis. It can also pick up yeast infections. All right. And as I said, when those pap smear results return, any abnormality, your midwife or your gynecologist will reach out to you. If it is to be treated by a doctor, we recommend treatment. If it is to be repeated, we recommend repeating of these pap smear tests, and we get it sorted out in a timely manner before anything should progress. All right? But the onus is on you to get your pap smear tests done. All right? Now, in the pap smear test, a speculum is inserted into the vagina. All right, it is then opened up so we can have a look at the cervix. A sample is taken of the cervix and it is sent to the lab, where it is put on a slide, sent to the lab to be tested. All right, now you want to give the pap smear results about 6 to 8 weeks before you check on the results. All right, it is a little bit uncomfortable. It should not be painful. I know many persons are of the notion that it's gonna hurt, but you need to experience it for yourself. All right, it is not painful. I'm telling you, it is not painful. It is uncomfortable. You know, something going into the vagina, it is gonna be uncomfortable, but it should not be. You should not be crying and hollering and all these things. You shouldn't be doing any of that. All right, it's a quick procedure, 5 minutes the most. We're out of there. All right. Who should do a pap smear test? All women who are sexually active. Once you have become sexually active, you must get your pap smear done. All right? Reproductive age persons with compromised stages. So if you're having genital warts, you're having HIV, any other condition, these persons, we encourage them to do their regular pap smears. All right? Frequency. Well, persons have different requests as to when you do your pap smears, but I'm going to go right off the bat as to what I've been advising my clients over the years. You do a pap smear every year, and after 3 normal pap smear tests, you can start doing it every 2 years. All right, so for the first 3 years, 1 every year. And after 3 normal pap smear readings, then you can start doing it every 2 years. All right. Now, how to prepare for a pap smear test? How do you prepare yourself? Do not use any suppositories or creams for 1 week before the examination. Alright, so if you were placed on a treatment by your doctor, you want to wait until at least a week after you have finished your course of treatment before you come and do your pap smears. And the reason speaks for itself. It can change the reading of the pap smear results. Alright? It can change the vaginal discharge, and hence we have a problem when it comes on to reading. And it will actually tell you, the test is so sensitive, it actually tells you everything. Alright? Do not have sexual intercourse or douche the day before a pap smear test. Alright? Schedule your pap smear between periods. So you don't come for your pap smear on your period. You come for your pap smear when you're not having a period. Alright? Please. After pap smear test, what will happen? So you might have a little spotting because of course you would have disturbed the cervix somewhat. So you might have a little spotting, which means that you might want to wear a panty shield. Alright? Follow up your pap smear results 6 to 8 weeks after you have done your pap smear test. Please find your healthcare provider that you did your pap smear test, follow up on your results. But I must let you know that even if you do not follow up on it, if there's anything abnormal, we will call you. But at the end of the day, you still need to know what your pap smear results are. Okay? If a repeat is required, so after you've done your pap smear test and if there's anything abnormal that returns and they're saying that you need to repeat it, please do. Do not be unwilling. Alright? If a repeat is requested, you come in and you do your request. It is better to be safe than sorry. Do not resent the recommendations of your healthcare provider. Alright? If you are referred to a specialist, so when the results return, these are some of the things that will happen. It is either requesting that you repeat the test, it is requesting that you be treated for a vaginal infection, it is requesting that you be referred off to a specialist. Alright? Please accommodate the process. Now, I will include a picture, some pictures of what a speculum looks like, alright, and what a wart looks like, and what cervical cancer looks like. So I hope that my little presentation today would have enlightened you as to the human papilloma virus. It is very serious, guys. It is very serious. Very, very, very serious. And the thing about it, many of us will remain asymptomatic, especially the men. So they go around and they have sexual intercourse and they infect a lot of person, and before you know it, a lot of ladies are showing signs, or they might not be showing signs, but the gentlemen rarely show signs. Alright? It is not until they see a little wart or a lump that comes up on the anus, the thigh, the penis, before they really know. Alright? But the ladies will show symptoms. Ladies, please get assessed. Alright? Reach out to me if you have unanswered questions. Remember, your pap smear test should be your yearly best friend. You should be looking forward to the next date to do your pap smear. Just letting you know that every health center has a routine pap smear day. Reach out to your healthcare providers to find out when is their pap smear day. Schedule your pap smear, get it done, follow up on your results, and whatever the case is, please accommodate the process. Alright, it was nice being with you today. Please do not forget to share, subscribe, hit the notification button so whenever I make a post, you are able to see what is happening. Alright, please stick and stay with me. I will be seeing you soon. Take care. Walk good. I am your registered midwife, par excellence. Thank you. Alright, so I'm going to be demonstrating how a basic pap smear is done. So after your breast and your abdominal examination has been done, this is what a speculum looks like. All right, so they have the plastic and they also have the metallic. All right, so let us pretend that this is our cervix right here. So the nurse will lubricate the speculum, of course, with some water, and we'll go into the vagina. Now we're into the vagina. Then we're gonna open. All right, so that's our little cervix right there. And then the nurse is going to use her brush and go in. If you realize this is not a rigid brush, this is very soft. All right, that's our cervix. She's gonna go in and we just take a sample. All right, we just take a sample of the cervix, just enough to get enough cervical components, and we take it out. We put this on a slide and it is sent to the lab for testing, and we just gently take it out. All right, so bear in mind, as we said before, this process is a little bit uncomfortable. It should not be painful. All right, so it's just a basic demonstration of how a pap smear is done.